Or, okay. Just let me know. Sure. Right. I'll be right back, okay? What you can start to do, you can start.
Hey. Okay. Let me get organized. I mean, I'm kind of organized, but let me finish getting organized. How's everybody doing? Crystal, you found us.
Huh?
I said, Rose got it to work and she got her own.
Oops.
I'm just muting people as they come on. Just okay. So for all of you that are joining, put your name in your campus in the chat, please. There's a couple of people. Megan.
Yes, ma'am.
I don't know why I made the note, but I made the note of asking you to stay on after.
Okay.
What campus are you from, Megan?
Cookville.
Cookville. Oh, good. There's somebody's alarm. Russell. Okay. Crystal. I have you at Cutler Bay. Megan, I have you. Who yet? Did I say that right? You're not there. Chelsea. Hi, Chelsea. And I can already see Chelsea. She says Cookville. Antoinette. Darren. DJ. I remember that. DJ, right?
Yes, ma'am. I go by DJ. You can call me Darren, either or.
No, I made a note from your email, DJ.
Yes, ma'am.
What campus are you from? Oh, you're from Port St. Lucie. I already have that.
Yes, ma'am.
All right, turn your camera on when you have a minute.
I will.
Antoinette, what campus are you from?
The Port St. Lucie campus.
Port St. Lucie, thank you.
Mhm.
Okay, Pendrika, did I say that right? Hi. You're muted. You're muted.
Sorry.
Hey, how are you?
How you doing? Good. How are you?
Good. You're on campus today.
Yes, I'm at the campus at Essendon. I was just talking to the dean and was talking to her about my schedule. And she told me that I start at 3 today in community.
No, we start at 1. I have you. Yeah. Wait. Oh, you're in the PN program, correct?
Yes.
Yeah, we started 3. Yeah.
At 3? Okay.
Yeah.
I'm sorry.
Ask her, does she have me in for 3 o'clock as well?
Also, Christopher Jones, do you have him at 3 o'clock as well?
I think I do. I think I actually do. Yeah, let me double check. Yes, I do.
Okay. Thank you. Then I will be seeing you at 3.
See you in a couple hours. Okay, bye. Okay, Tayet.
Hi.
How do I pronounce? Did I butcher your name?
It's pronounced Thwit, but I go by Mary.
Mary. Oh, that's easy.
Yeah,
write that in there. Yeah, let me write that in there. Hang on. And I have you from Pensacola.
Yes.
All right. Awesome. Antoinette, Mayona.
Yes, ma'am.
How did I say that? How'd I do?
You got it right.
What, Mayona?
Yes, ma'am.
All righty. Awesome. And campus, what campus are you from?
Pensacola?
Pensacola. All right.
Yeah.
There's DJ. Hey, DJ. Paula Banks. I have Paula Banks. What campus are you from?
Bill.
Cookville. Okay. Welcome. I don't get my official, pardon me, I don't get my official roster till like week 3 when everybody's situated in their classes. So I don't know campuses until week 3. So I can't wait till then. I like to know things ahead of time. So Jacob. Hey, Jacob.
Hello,
Hey, how are you? What campus are you from?
Port St. Lucie, Florida.
Awesome. God, I wish I was in Florida right now. I'm in Colorado. It's freezing. Okay. I think that's everybody so far. So for all you guys that have come in, please put your name and campus in the chat. Okay. And I am recording already. Want to catch everything. Okay, still missing quite a bit of people. Is this class full of students that are also taking peds and med-surg too? Is that about? I know there's some students that are on different paths. I get that, but for the most part, are you all taking med-surg and peds?
Yes, ma'am.
So far, I have Cookville, Pensacola, Port St. Lucie. I do have Crystal. You're from Cutler Bay, so I do have Cutler Bay. So far, we have 4 campuses. Okay, awesome. Okay, Christina, hi. Welcome. I have you from Port St. Lucie, Christina. Karen, let's see, Karen, what's your campus?
Hi, it's Cutler Bay,
Cutler Bay.
Miami.
Awesome. I wish I was in Miami right now. Okay. Selena, hi, good morning.
Hello.
Hi, I have you from Port St. Lucie.
Yes, ma'am. Port St. Lucie campus.
Cool. Jennifer, hi, welcome.
Hi, how are you?
I'm great. Thanks for asking. I have you from Cutler Bay.
Yes, ma'am.
Alyssa, hi.
Hi.
Alyssa, did you recently transfer into this class?
No. No, I
Okay.
should have been set for this class. I switched my Monday class, my leadership class.
No, that's okay. I just don't have you on my roster, but I haven't printed a new, it changes, it seems like it changes every hour. So, and, Alyssa, what, and that's you don't go by any other last names, right? Baca?
No, yep, that's my last name.
Okay, cool. And what's your campus?
Fortis.
Which one?
Fortis, sorry, in Scranton. I'm wondering if I'm on the wrong schedule.
Oh, you might be on the wrong.
My schedule.
Are you're PN?
Yes, yeah.
Yeah, you're this, hang on, you're this afternoon. Let's
I might.
see. Yep, I have you're this afternoon.
Okay, I was about to say, I think I might be on the wrong schedule then.
Yeah, you're Scranton?
Yep.
Okay. Oh yeah, I have that on here. Yep, you're in a couple hours.
It's 3, you have me as 3?
I have you Wednesday PN at 3 o'clock. Yep.
Oh, that's weird. It was on our schedule for 1.
What on what?
I'm sorry, go ahead.
No, no, the RN class is at 1 and the PN class is at 3 today.
Okay.
What schedule was it? Alyssa, what schedule was it on at 3?
It was on our main schedule, so I don't know if other people from my class are going to be logging on at the wrong time too, because I know we were talking about it being at 1, our class.
Yeah, I already had one student.
Okay.
Okay.
All right. Yep.
Let's
All right. Thank you. See you at
see
3
a
then.
couple hours. Yep.
Yep. All right. Bye.
Ania, good morning.
Good morning.
How are you?
Good, and yourself?
Let's see. Ania, what's your campus, Ania?
Port St. Lucie.
Port St. Lucie, awesome, welcome. Faith,
Thank you.
what's your campus, Faith?
Cookville.
Cookville. Awesome. All right, and then Lisette, did I say that right? Or I already have
Yes.
you, Port St. Lucie, okay.
Correct.
Ghana,
For
is
St.
that how you say your name?
Gianna.
It's Gianna, well, you have it spelled Ghana.
I know
on your-
it's
okay,
that.
Gianna,
So that's how you
okay.
spell it, but you say Gianna, yes.
Oh, okay. Gianna, okay, let me make a note of that. Gianna, and what's your campus, Gianna?
It's Forest Pensacola.
Pensacola, okay.
And I have a question. Can you see me? Because on my side, I see my camera is doing something.
It's doing something funky.
Okay, let me, I guess I'm
like
gonna
blink-
try to yeah, I'm gonna
It's
try to
like
log in from
blinking.
my phone
Okay.
then, because
alright,
computer's
alright.
not working. Okay, sorry.
Olivia,
Yes.
what's your last name?
Zito,
Okay, what campus?
Pensacola.
Pensacola. Okay. Okay, Rebecca. Hi, Rebecca.
Hi.
What campus are you from? Welcome.
Port St. Lucie.
Port St. Lucie, awesome. Okay, Devin. See, yes, I have. What campus are you from, Devin?
Cutler Bay.
Cutler Bay. And then there was somebody, it says Carlar. What's that? Is that? I don't know who that is.
Yes, that's me.
Is that Carla?
Roque, Roque.
Okay, yes, I see you. What campus are you from?
Port St. Lucie.
All right. All right. Did I get everybody? Jasenia, I didn't get you.
I'm from the Port St. Lucie campus.
Port St. Lucie.
Yes.
Okay. All right. Did I miss anybody? Okay. So for those of you that either don't have your last name, well, first of all, let me start by saying, have you guys already had peds or med surge this week?
Yeah.
Somebody's had it, a few have not. Okay, because we're going to be going through the orientation PowerPoint again, and specific to community. So if you've already had it, you're just going to have to, it's a requirement the first week that we have to go through it with everybody. Okay, so some of you shook your head no. So anyway, so good afternoon. Let's see, it's 1 o'clock Eastern time. So that's for, I think most of you might be in Central time, right? Most of you in Central time?
Port St. Lucie campus folks are on Eastern time.
Oh, Port St. Lucie is definitely Eastern time. Cookville Central time, right? Cutler
Pensacola.
Bay, Pensacola is Central time, right?
Yes, ma'am.
Yep. And then Cutler Bay is probably East Coast time, right? Cutler Bay students, East Coast time?
Yes.
Yes,
Yep.
ma'am.
Yep. So we have East, Central, and I'm Mountain. I'm in Colorado. So it's 11 o'clock for me. Right? How is everybody? Are
Do
we
you
all-
teach at the Denver College of Nursing in Colorado? Oh, okay. Sorry.
Nope. But I help them start their program. Yep. So how, on a scale of 1 to 10, how excited is everybody for community?
10.
So I always like to ask, first of all, put your names and campuses in the chat, because you know we have a whole new attendance policy, right? Everybody knows that, right? You've probably been hearing it in your sleep. So attendance is taken through the, I always make sure everybody's in the chat so I can make sure everybody's here. But then there's no more attestations. Remember the old attestations where you put in, you attended class, whose class, what time, and you don't have to do that anymore, right? We do it all, right? So this is recorded. And so what happens is I get a report after the class. I don't deal with it during the class, who's coming on and off, and I just don't want to be distracted. So I get a report after class and just go through it and make sure people were here, and either if you came in late, you have to deduct time. If you leave early, you gotta deduct time. So best you just treat this like a on-ground class where you're here and you're present and you're engaged for the hour and a half, right? I mean, the class is now down to an hour and 40 minutes, right? And technically you have a 10-minute break. My Monday class decided that they wanted to forego the 10-minute break and just plow through for an hour and a half. Anybody have any huge objections to that, or would you like to do that? Plow through? Okay, and I have to keep remembering this is my RN class because I teach 3 PN classes, right? Yeah, this is my RN class. PN comes after. So I teach in both programs, RN and PN. I'm the course lead for the PN program. I'm starting my 3rd year with Fortis, and I love it. Absolutely love it. Cut along. Come this May, I'm going to be a nurse for, I know I'm dating myself, but 40 years. So I started out early. It's all in my bio, but my experiences. I started out in the military in the 80s. Did about 10 years of Navy nursing. Loved it. Then moved to Colorado and raised 4 kids here. In the meantime, I started out as a NICU nurse back in the late 80s, early 90s, and then became the director of Women's and Children's Services at a big hospital here in Denver. So I did that for about 17 years. And then last year, I just retired from doing 20 years as a school nurse. I worked for a huge district out here in Colorado, and we were called nurse consultants. We covered many, many schools, all the way from preschool to high school. So on any given year, I had a preschool, an elementary school, a middle school, a high school, fed programs. So I did that for 20 years, loved it. That's where I got a lot of my community experience. And then I transitioned into education, which is where I am, and really, really, really love it. Love it, love it, love it, love it. So I'm happy to be here. I consider this whole group, we're one big family for the next 11 or 12 weeks, right? We're all going to get each other across the finish line, right? Because this is not a class. This class, I don't know what you've heard, okay? I mean, there's all, anybody heard any good stuff about community class? What have you heard? My PN group on Monday had a whale of tales about what they've heard from previous students. What have you heard about this class? It's really hard.
Yeah, I've heard it was pretty difficult.
Okay. What else have you heard? I'm just curious. Pretty difficult. Okay. What else? Fair.
I heard the same.
It's not, but I'll go with it. Go ahead. What else have you heard?
I heard it was boring.
Okay. Appreciate the honesty.
I heard a lot of homework to do.
Say that again. A lot of homework.
Correct. Yes.
The goal and the objective in this class is just to keep up. Okay, it's a 2-credit class. I realize that, and the work associated with the class goes along with a 2-credit class. Okay, there's no clinicals, there's no sims, no labs with this class. Why do we think that community, this class, is placed at the end of your curriculum? Because you guys are right. You're 7, right? Term 7, right? Most of you. So you're 1 term away from graduating. When do you guys graduate?
July.
I was gonna say June or July. Okay. So why is this class placed at the end? Come on.
It covers everything.
Who said that?
Me. A lot of the students said it
Mary.
covers everything.
Mary.
Yes, ma'am.
Yes, go ahead. Tell me why.
Some of the previous students just said it covered everything. Like you would need to know all your info from foundations, health assessment, MedSearch One, to be able to succeed in this class.
Mhm,
Yeah, they said it just covers a little bit of everything.
mhm. So yeah, that's exactly right. This is where we put all the pieces together. Right? Because think about it. You are essentially going from taking care of clients in, say, a hospital setting. You're now caring for them in the community. All right. So let's say you've discharged a stroke patient or a patient with diabetes or a patient that had a heart attack or substance abuse, and now they're going home or they're going into a assisted care or a rehab. They still need care, right? But it's in the community setting. Okay, so we still need our med-surg skills. We still need our foundation skills. We still need our geriatric, our maternity. Because in community, you're potentially caring for clients across the whole lifespan, right? All the way from babies, starting from babies, maybe working with new parents, new families, all the way up to the elderly. Right, so this is the point where we pull everything together. So most of the concepts that we will cover in the class, you've already been introduced to over past classes, right? So you may find your exams pull from, the exams are actually, there's a lot of, I can tell you the HESI for community is very med-surg focused. All right, so the expectation is that you're bringing all your tools that you've learned over the last 6 terms and bringing them ahead to this class. Okay. Some of you maybe go into community nursing, most of you won't. But the important thing is, even if you don't, you'll always be interacting with nurses in the community or healthcare teams in the community, right? Let's say you're discharge planning, discharge teaching. What are you teaching for? To go home. Right, so community nursing is a huge umbrella. When you guys think of community nursing, what do you think? What do you think happens? What do you think a community nurse could do? What kinds of
I would
community
think more
nurses
so
are
like
there?
working for the Department of Health and like keeping track of like breakouts as far as like STIs or
Yep,
more so things like that.
yep. That's one aspect of it. Great. Thanks, Devin.
Or not even just STIs, also like HPV, like a lot of things that are more so like contagious, like tuberculosis. If they have a large number of 12 cases of tuberculosis, then in this certain state or this certain district, they would have to like notate that.
Yep. What about outbreaks?
Yeah, like
Outbreak. COVID.
Yeah.
My last 2 years in the schools, I became, instead of the school nurse, I was a COVID nurse. So I'll be there for 2 years. COVID, go. So, COVID really elevated the community nurses role in public health nursing throughout this pandemic. So yeah. Hey, Carla, can you turn your camera on, please?
I think of anything that isn't bedside nursing when I
Okay.
think of community nursing. So like school nurses, rehab facilities, skilled nursing facilities, places, that aren't necessarily at bedside or in a doctor's office.
Okay.
Also immunizations.
Immunization nurses. Yep. Olivia, you mentioned school nursing. We also have faith community nurses. Right? Has anybody ever heard of faith community nurses that are within congregations
Like
in the community?
outpatient clinics.
Outpatient clinics. Yep. Occupational health nurses. Right? Occupational health nurses are nurses who are responsible for safety in the workplace. Any place you work has an occupational health department or nurse, right? Okay, what else? Home health nurses. Typically, those are the answers I get. Students think of community as as home health nurses. Yeah, that's part of it. But you could also be a home health nurse, but you could be a hospice nurse, right? You could be a school nurse. You could be a You could be an immunization nurse. You could be a patient education nurse. So lots and lots and lots. It's a huge umbrella. And we just, we scratch the surface in this class of real introduction to concepts of community-based nursing, right? ADPI goes right along with community nursing. We have to take our ADPI skills from the hospital setting out into the community. So do an assessment of, let's say, a pediatric patient with asthma in the hospital looks different than an assessment out in the family home, right? But ADPI still is in play all the way through community nursing. Okay, quality improvement, quality assessment carries right from the inpatient settings to the outpatient settings, right? So my advice for this class is you just carve out a little bit of time each week and get your community work done. It's not that much. Okay, there's no reason anybody needs to fail this class. Okay, my advice is to just keep up. Just keep up. It's not that much. And actually, if you kind of take off your, oh, I'll never be a community nurse, or I don't want to work in the community, that's fine. That's fine. But just look at this class as different than your peds and med surg classes. Okay, look at it as pulling everything together, tying everything together. Okay. The other thing to think about in community nursing is setting. You may be in a big city, working in a community nurse setting. You may be rural. We cover a lot about rural nursing, migrant nursing, agriculture. What happens to the community nurse when you're shifted from the urban setting out into the rural setting? Pretty challenging to be a community nurse out in the middle of nowhere with very limited resources. Okay, so we'll cover rural. When we think of community nursing, what do we think about as far as the clients we care for? One of the things we focus on every week throughout this course is vulnerable populations. Okay, every one of our communities has vulnerable populations, right? So what are some vulnerable populations in your community?
Homeless. Yeah, elderly, low income.
Pediatrics.
Kids. Yep. Substance abuse. Right? Mental illness. I mean, who do you think cares for all these vulnerable populations in your community? It's your community health teams, your public health nurse teams. They're cared for, right? In week 9, you're going to do it's called a vulnerable populations assignment. And I'll talk about that when we get to the syllabus. But basically, you're going to pick a vulnerable population in your community that you want to do research on. So within your zip code. And you're going to do a research paper on it. And there's guidelines for it. But really good, really productive assignment. The other thing before I forget is, your professional development plan is due Sunday, right? We all know that. And the template, did everybody find the template in your week 1 module? Just use the template. I mean, you can free write it if you want. It has to have certain long-term, short-term objectives, what you currently do, what your roles are, but we provide a template that's super easy to do with it, okay? This isn't a difficult assignment. It's really just kind of reflecting. Okay, so get that done. That's your assignment for Sunday. Shouldn't take long at all to do that. And actually, it's my favorite assignment to grade. I love reading about your professional development plan. It's pretty awesome. Okay, so that's my mantra is don't blow off this class because you need it to get into, you need to go on. It's not a whole lot of work unless you make it a whole lot of work. Carve out a little bit of time each week to get your community assignment done and be done with it. And you can go focus on med surg and peds. hear a lot of students say this is, and I know, trust me, I know this is one of your more difficult semesters. I know it is. And I know a lot of students think, why do we have to take community? Well, because community is part of nursing. In fact, quite a bit of our care has shifted out of the inpatient setting to where? The community. Right? Think about it. So anyway, I sent you, I'm gonna, each week I'm gonna send you a recording, which I did, on the concepts that we cover this week. So it's like a mini content lecture. Okay, the goal for each week is that you come to class prepared so that we can, in class, work on activities. We can do case studies, we can do Kahoots, we can do breakout sessions in breakout rooms to answer critical thinking questions. Because remember, with Next Gen, what is it moving towards? It's moving towards critical thinking and clinical judgment, right? So yes, you have the knowledge. Now you need to know what to do with the knowledge or put that knowledge into practice, right? So I don't spend the whole time lecturing. I don't. I have, but with this Next Gen shift, I've got to get you guys, we all the faculty, we have to get you guys critically thinking to now apply your knowledge into practice. Okay. So expect to be broken out into groups every week, and whether you have case studies that apply to the concepts that we're doing this week, whether we have a Kahoots, whether we have critical thinking questions. Yeah, it's very activity based going forward with Next Gen. Okay. You guys don't need to sit for an hour and a half and listen to me talk. Plus, I don't want to listen to myself for an hour and a half, but so anyway, before we go to this PowerPoint, couple things. One, if anybody is repeating or you are repeating any class, if you're a repeat student, if you're a re-entry student, or if you're a student that has accommodations, I need to know about that. Just shoot me an email. Okay. I'll figure that out. I won't figure out the accommodations in week 3, but I will figure out who's repeating and who's re-entering. But I like to make contact before week 3 for my re-entry and repeat students, because there's no room for failure this term. And I'm telling you guys, this is not a class you want to fail. It's not. It's not necessary. Just keep up. So I need to know about those 3 things. I need to review some changes in the syllabus with you as far as chapters. We know there's no attestations. What else? What burning questions do you have before we get? We're going to cover the orientation PowerPoint, then we're going to jump to the syllabus, and then I'm going to run through the modules with you. That's what we're going to cover today, because I've already provided you the PowerPoint, right, for week 1, and the recording, content recording. Okay. And then we'll revisit any questions from week 1's content next week. Exams in this class are weeks 3, 6, and 9. Okay. We do reviews in weeks 2, 5, and 8. Okay, there's 4 or 5 reviews, live reviews. Okay, we're working on our master schedule now, and we'll send you out a master schedule of all 3 exams and the HESI review time, so you can plan accordingly for the whole term. Okay, there's, I think, 7 professors in the RN community program. Many of us just teach 1 class, but there's lots of opportunity for review sessions. So so the reviews are the week before. You'll get study guides. I hope to get.
You do a HESI review? I'm sorry.
Yep.
I mean to interrupt you. Oh,
That's okay. I was just going to get to that. So week 10, all of our classes, all the 13 sections are all HESI reviews. Okay, so you have to attend. You can attend as many as you want during week 10. All the professors during all the class times, you have to attend at least one, but you can attend 5 or 6. Okay, because we're all providing the same information, just presenting it in different ways. So there's plenty of HESI review, plenty. And then I hope to be getting you out a study guide for the first exam by the end of this week. I like for you guys to have it way ahead of time, so you could be looking at, kind of comparing your notes, comparing the recordings, comparing everything to weeks 1 and 2, because exam 1's going to come up real quick, right? Next week is week 2, which means in week 2 we're doing exam review for exam 1. Okay. Okay, so what burning questions do we have so far?
All classes and all reviews will be recorded?
Oh yeah, everything's recorded. So this class, even though you get a mini recording from me over the weekend, you'll get a weekly announcement from me over the weekend or on Sunday that will have that recording, that content recording. And then this class, your actual schedule class, will be recorded, and I'll send that to you later today. And then all the reviews are recorded. And so we share those with each other. So you have the opportunity, let's say there are 6 reviews or 5 reviews. You'll not only have the opportunity to attend 5 live reviews, but you'll have 5 recordings. Plenty of opportunity for review sessions. And we know that live attendance shows better grades. That's just a fact. So that's why we try and give you the schedule in week 1 way ahead of time for all the reviews throughout the whole term, so you can try and plan ahead. Okay.
Any information that you sent to the class prior to today, I don't think I actually received, because I don't think that I was on your syllabus. I actually got even the information for your Zoom from another student.
So are you listed in the class now?
Yes, ma'am.
Once you're listed in the class, you should have all the previous postings. Is that not true?
Postings, like as far as
Announcements.
announcements, yes, but like information that you said that you sent, I didn't receive.
I haven't sent anything else other than announcements.
Well, I don't think I received any announcements prior to today.
Okay, so while we're on, check your announcements and see, because if you just
No,
got
I
added.
did check them.
Oh,
We've been looking for the Zoom, and the only thing even that I found was like for where there was a like place where I could click Zoom, and it was like saying upcoming, and there was none in there, or cloud Zoom.
yeah, all that information's in my announcement. So Devin, stay on after.
Okay.
And we'll get that sorted out for you. Anything else? Any burning questions? Carla, are you still there? I can't tell. Okay.
I'm still here.
Okay, you need to have your camera on. Okay, your camera's been off.
Okay.
Please. Okay. Okay, any other burning questions before we get to the PowerPoint? I think if you just sit back and relax and try and enjoy this class and take off your hospital hat and your clinical hat and just try and enjoy, but trying just look at this as just a big picture part of nursing, community nursing. Okay, where it focuses on lots of different things. So, all right, let's get to the PowerPoint. Did everybody complete there were a couple of people actually. You have to complete the technology quiz, syllabus quiz. Most of you have done it. There are a few people that have not. That has to get done. Okay, that has to get done. And it has to get done really by the end of this week, because you don't even have access. If you haven't done the quizzes, you don't have access to the shell. Okay, so anyway, okay, I'm going to share my screen. Make sure everybody has their name and their campus in the chat. As far as me as a professor, I'm super easy. Okay, I'm super easy. I'm super flexible. Okay, the only thing I ask is communication. You have to communicate with me if anything's going on. I don't need to know the details if you don't want me to know. I'm not invading your privacy, but if there are things that are preventing you from being successful in the class, you have got to reach out to me. Okay, I can't help you if I don't know. All right. I could be as flexible as I can be within the Fortis policy. Many things I can be flexible about, but there's certain things I can't be flexible about. Okay, but I'm super easy to work with. I really am. Okay, you just got to keep in communication with me. Okay. All right, let's go to the PowerPoint. The PowerPoint. Does everybody see my screen?
Yes, ma'am, we can see it. Well, at least I can. I don't know about everybody else.
Oh, I don't know why it says Zoom quit unexpectedly. Can you guys see me?
I can see it.
Am I back? Am I here?
Yeah, you're here.
I'm here. I'm here and present. Okay, hang on. I just have somebody that this might be a PN student. Sorry, guys. 1 second. Maybe not. Hang on. Nope, they're off. Okay. Okay. Try this again. Share screen. Okay. Can everybody see this? Yes?
Yes.
Okay. So some of you, this may be a repeat, and I apologize for that, but I do have to go over it. Okay. So let's go. What's online learning? You guys are in term 7. You know what online learning is, correct? Okay. This course is to be treated like a ground course, you know, to be present, engaged, and participating. Okay, just like you would do at a ground. You know, just because it's an online course doesn't mean you know, taking care of your kids, up cooking dinner, up cooking lunch, you know, on and off camera. It's just not the way it works. Okay, you need to be present, engaged, and participating for an hour and a half. Okay. Let's see. I'm available. I know in your syllabus cover sheet, I just typically put the hour before class as my office hour every week because we have to list a specific office hour. But I won't come on unless I have scheduled time with you guys or you've let me know you want to meet, but know that I'm available to meet whenever. Okay, I'm available to meet 7 days a week. Okay, mornings before you go to school or evenings when you get home, you just have to reach out to me. Okay, I'm really quick at responding to emails. If you want to text me, that's fine. My phone number's in the instructor bio. I don't care if you text me, that's fine. I'll get back to you as soon as I can. I don't even have hours or other factors that says I won't return anything between 10 p.m. and 6 a.m. I don't know if I'm up after 10 and you text me, I'll respond to you. Okay, just identify yourself on who you are. Okay, because your number will just come up as a number. It won't come up as a name until I save it. Okay, just like your on-ground classes is weekly assignments. Again, most of you guys are in term 7. You know all this. All right. Here's who to contact. You guys have had these orientation PowerPoints at the beginning of every term, right? Okay. So what you need to know for here is who do you contact first? Me. Okay. Contact me first. I will try and help you with whatever I can. If I cannot solve or answer your questions, then I'll reach out to our course lead, who is Dr. Lundy. Okay, and she can assist me with helping with whatever I can't solve. If her and I cannot help solve the problem, then we'll get Dean Brown involved. Okay. And everybody should have Dean Brown's information. Actually, this is probably a slide you should save, right? Because it has Dr. Lundy, your course lead's information. It has Dean Brown's information. Okay. But in my profile at the bottom where it has my contact information, underneath my contact information, I've also put Dean Brown's contact information. So you have that in a couple of places. Okay. Okay. And feel free, anybody jump in, interrupt, or not interrupt, but jump in and chime in if you have any questions. So contact me. I'm available by email. Everybody's got my email, Canvas messaging, by phone, right? What am I going to do for you? I'm going to suggest ways you can improve. I don't mind tutoring. I tutor lots of students all the time, but tutoring goes both ways. I need you to be prepared with what you need to be tutored for. Okay, tutoring just because you missed a couple of classes isn't going over all the content. Okay, tutoring is, so for example, if you are getting ready for exam 1 at the end of next week and you've read through the study guide, you've done your due diligence, you've gone back and read through your readings, and you still have a couple of topics or concepts you don't understand, let's schedule a time to go through those particular topics. Okay, so I'm happy to tutor. Okay, yeah, I provide feedback on your assignments and feedback when you submit things. So please take a look at that. I think I'm very experienced in the content area, been in community nursing for over 20 years. And we know this is like your ground classes. This is the professional setting. I know it's online, I know it's different, but it's a professional setting and there's etiquette, right? There's no more like laying in bed, listening to class on your computer or laying on the couch or cameras off or anything like that. It's got to be treated as a professional environment, just like you would do on your on-ground classes. Okay. So you can go through this, but you all know, I don't typically have any very little issues with etiquette and behavior in my classes. I just don't. And if I do, I'll pull that student aside. Okay, you all know that your classes have start times, end times. They're mandatory every week, right? Now with this new attendance, it's really mandatory every week. You're going to have a couple of, I think you have 3 discussion questions and then a group discussion. All your discussion the Wednesday assignments you have that are due are your discussion question weeks, right? You guys know this from previous classes and previous discussion questions, right? Want to review this. This has been in place for a couple of terms now, late work policy. Okay. This is an area that I don't have flexibility with. Okay. This is expected to be followed standard with all the faculty. All right. So first and foremost, you got to let me know. So let's see. Monday morning. So I get into the grade book Monday morning after all your professional development, after your professional development plan is due. Let's say I have 5 students that haven't turned it in. If I haven't heard from any of those 5 students, it's a 0. They don't get the benefit of this 1 to 7 days. Okay. If I've heard from 4 of them that they're going to be late, okay, I said, okay, you're going to be late. You have a week to turn it in and you'll take a 10% deduction. But first and foremost, I need to hear from you. Okay. So if you haven't turned it in on time and I haven't heard from you, you don't get a week to complete it. It's an automatic 0. If I have heard from you and you want to take advantage of that week, that's fine. Get a 10% deduction. These aren't my rules. This is definitely the university's rules. And this is something I can't be. Anybody have any questions on this? It always never fails, it comes up. And this is the policy in all your classes. This is in Med-Surg and this is in PEDS. Right? And in this class, I keep saying, just get it done. Not that much to do in this class. Get it done. Okay, attendance. I need everybody to sign in with their full names. So when I'm reading your names, let me stop sharing here for a second. I think I have everybody that has their full names in here. That's first, Olivia, I need work on it for next week. Olivia, put your last name in there. Carla, you'll have to put your last name in there for next week. Okay, so you gotta have first and last names in there. And I know Dean Brown has sent out information about my back. I don't know what's going on here. I'm just trying to share my screen. Okay. So full names. Pardon me, you have to be on camera the whole time. Okay. Your camera cannot be pulled, just like, you know, you can see my face, you can see my background. You've got to be on camera. You can't be, camera can't be pointed to the ceiling or pointed to the ground. If that's the case, I don't know if you're there. I don't know if you've just turned your camera on and walked away. I have no idea. So yeah, just like on ground class, you're present, you're there. I need you like that in the online setting. Hey, driving is a no-no. And we did clarify in our faculty meeting last week, this includes being a passenger. Okay, you cannot be in a car. You cannot be pulled over to the side of the road and listening to class. You can't. It's not acceptable that this term is being enforced. All right, anybody with a camera not on will be asked to be removed from class. All right, I maybe will give a warning or two, but I really don't want to be distracted with having to single out students in the middle of a class for not having the camera on. If the camera's not on, I'm just going to hit remove, and we'll have to talk about it after. It's just not fair to the other students.
So say if you have to use the bathroom or step away for a minute.
Yeah,
are we
that's
supposed to
fine.
text
No,
you?
no, I'm fine with that. But I'm hoping with an hour and a half class, you've got your drinking water, you've gone to the bathroom, whatever. I'm hoping you've done all that. I'm not splitting hairs with getting up and going to the bathroom. I'm not. Just be mindful of what the new attendance structure looks like. Does that answer your question, Rebecca? Okay.
Yes.
Yeah. I'm not splitting hairs about that. This is for, you know, you sign on and then you're gone. You know, you sign on and then your camera's pointing to the ceiling. That kind of stuff. I'm not. You need to get up and go to the bathroom. You need to go get a drink of water. Whatever. Okay. And then, like I said, I'm not messing with this logging in and logging out during class time. I'm not. I don't want to be distracted. I'll get my report at the end of the class, and then I'll go through, and because we have to submit a report of time missed. Everybody's considered present for the whole time in this report that goes to the registrar. And I only have to enter if there's missing time. That's it. So everybody's considered present. Okay, but I won't do that until after class. I'm not wasting my class time doing that. You know, attendance is recorded in 15 increments. So if you come in at 1:05, you're going to be docked 15 minutes. If you come in at 1:20, you're going to be docked 30 minutes. It's all in 15-minute increments. And then as you start to build up missed time, it's going to add 5% of the total time. You're gone 10% or 15%. You're going to start getting letters, and that's all outlined for you in the email. Just, you know, they've repositioned the classes so that there's no overlap. That's why we end at half after the hour or 40 after the hour, so you have time to get ready for your next class. So there's really no excuse for being late. And you don't want to be docked 15 minutes and all that. And it's a report, so I have to follow the report. I can't just scratch it out and say, oh, you know, they were 2 minutes late or whatever. It's a report that has to get submitted with the report has to get submitted with the form you have to fill out to the registrar. So anyway, anyone without posting attendance in 14 days will be dropped. You guys know that. We just talked about attendance, early departures, tardies, class cuts will be recorded. Attendance maintained by the registrar. Students with chronic absenteeism in excess of 20% of the scheduled hours for the course may receive a failing or reduced grade for the course. Students who end up being absent more than 20% of the scheduled time will receive a full letter grade deduction at the end of the term. So again, we finish 3 of here's the way I look at it. 3 of the weeks this week is orientation week. Okay. 3 of the other weeks are exam weeks, right? That's 4 weeks. Week 10 is a HESI review week. That's 5 weeks. Okay. So we're really looking at weeks 2, 4, 5, 7, and 8 that are regularly scheduled content classes. Does that make sense? So there's really no excuse unless you just don't want to do it. So the level of intervention or letters or warnings or whatever you're going to get it's going to depend on the amount of time you've missed. Okay. And I can't fudge with these reports. The report is being generated by this meeting. Okay. I'm assuming you guys being in your 7th term already are practicing these 7 steps to success, right? Review the work each week. I try and review work ahead of time. So like when we get to the module in a little bit, I try and review what's going to be due in week 2, but you should be reading ahead of that. Anybody that is thinking, oh, I didn't know and it's Wednesday, so it's due tonight. Anybody who hasn't read ahead to know that you have an initial post of your discussion question that's due tonight, you need to be on top of that. Just because we have class on Wednesday, you don't wait for Wednesday for me to tell you something's due tonight. You should have already reviewed week 1, right? And I have people who have turned in their initial posting, but from this class and my Friday class, it's not a lot. So I just I knew I was going to tell you guys in class today, even though we have a Wednesday class, you need to be mindful on Sunday of what's due Wednesday. There's only four weeks, I think, that you have something due on Wednesday in this class. But you need to be mindful of that. And I had to send my Friday class a message this morning saying, hey, I know we don't have class till Friday, but you guys have a discussion question due this week and your initial post is due tonight. Pardon me, don't wait till class. You get to class Friday and say, oh, I didn't know it was due. This is part of your 7 steps to success. Review the work that's due each week. Complete the reading assignments. Class is mandatory. And always, you guys know this already, look at the rubrics. That's how I grade, right? The rubrics are a guide to your assignments. This class will include NCLEX questions, discussion questions, HESI case studies. You got a professional development plan. You've got a group project, actually 2 group projects, which we'll talk about. An infectious disease project, and then a case study. And then you've got a vulnerable population assignment. Okay. How to be successful, you guys should already be doing this. Stay connected with me, our reliable internet. If you need to go to campus to take an exam, if you need to go to campus to listen to class for reliable internet, please do. Make arrangements. Talk to your dean.
I have a question. I'm sorry.
Mm-hmm.
Do you mean that the discussion question is due next week, right?
No.
Because it says week 2. That's what I see.
Yeah, I see the same thing as
Yeah,
well.
you guys
It's
don't have
it's
anything
under
due
just a
tonight.
development plan for this week, and then week 2 is discussion that I can see.
So next Wednesday, you have your initial post of your discussion. Correct. Yeah, I'm confusing my PN and my RN. PNs have
Thank you.
question due this
Thank
week.
you.
Yeah. So professional development plan due Sunday. Okay. When I was referring to class today, I was referring to my Wednesday PN students who I have after you. I think I have very little submissions for initial posting, so sorry for the confusion. The other thing with having a reliable internet for exams and stuff, like for the last 2 terms, my Centerville students have all gotten together as a group, found a proctor on campus, and they've all taken their exams on campus with this proctor. I have no problem with that. That's fine. If you guys want to organize to take your exams on campus, and you find a proctor, just let me know. Okay, I have lots of students who do that. Okay, log into class 4 to 5 times a week, review announcements. The announcements I'm going to send out are going to be sent out by Sunday. Submit your assignments when they're due. Do not procrastinate. We don't have to go through keys to success. You guys already know how to do day one, log on, all that. You already knew that. What else didn't I cover here? Weekly review. No, sessions held outside of class by all. This is, we talked about this, the review sessions and the tutoring sessions. Here is a summary. This is taken right from the syllabus. So your KGAs, which you all know what they are 3-unit exams and a HESI. Each is worth 20%. So each of your exams are 20, 20, 20, and then you have your HESI, which is 20. Okay, so 80% of your grade is KGA. Okay, so then the rest is homework. Okay, your vulnerable populations, take a look at that, 8%. So this is an assignment you don't want to blow off in week 9. Okay, you got your professional development plan due. This week, case study, you have that first case study is your first group project that's due in week 3, which I'll tell you about. Then you have 4 groups of NCLEX, 50 questions each. You have 2 RN case studies. This NGN case study, I still need to get more information on. This replaces your Kaplan. There's no Kaplan for this class starting this term. No more Kaplan. And then you have 4 discussion group questions. 3 are individual and 1, the last one is your second group project. Okay, and then your weekly live sessions. So we all know about KGAs, right? At the end of taking your HESI, you have to have your 78, right? Before any of this from here down gets added in. And in this class, you do, well, any class, but particularly this class, you do not need to be a homework fail. Everybody knows what a homework fail is, right? Yeah, no, not in this class. Don't let it happen. Okay. I'll turn on the homework scores in the middle of probably week 6 and 7. That's just to show you how your homework, if you're turning it in, it's going to bump your grade up. If you're not turning your homework in, it's going to drop you. Okay, we just talked about that. Exams scheduled through ExamSoft. I would just double check ExamSoft between now and week 3, just to make sure your account's active and working and all that. There's no glitches. I will you guys are Wednesday, so I'll probably turn on the exam for you to download on Tuesday, Monday or Tuesday. Okay, you'll be able to download it, and you guys know the drill for exams. Nothing has changed. Okay. So accommodations. I need to know about accommodations because those need to be factored into the exams every term. Okay, so I definitely need to know about accommodations. As far as taking an exam, there's really no more of, hey, I have a med-surg exam on Monday or on Wednesday. Could I just take my community exam another day? It doesn't work like that. Not this term. Okay, you are expected to take your exam on a given day unless there's a total outstanding emergency that you can't do it. And what do you do if something like that's going on? First and foremost, you've got to let me know. If you go in and take the exam and you haven't let me know what's going on, say you do poorly and say, well, I had this going on, you've got to let me know ahead of time. And we'll see, and I have to contact Dean Brown and we'll problem solve as to how we can help you. Okay, so there's really no exceptions unless you've contacted me. Okay. Do you know about exams, showing IDs? No headphones, all that. You guys know all this. Missed exams will be held to the late work policy. Okay, so if you just don't show up for an exam, it's a 0. Okay, especially without any prior contact with me. If you have to change the date of your exam to a different day because of personal reasons, you'll end up, that's fine. You can take it within the week. So like if the exam was today, you would have till next Tuesday to take it, but you'd have to take a 10% deduction. And any exams missed due to an emergency, will require documentation. So if you need to review slide 24, please do. Okay. As I just said, contact me before the exam, not after. I can't help you after. Contact me if anything's going on, homework assignments. I assume you're already doing these, planning your time, planning, prioritizing, completing work, and submitting work. If you want to review this, here's what I suggested. Schedule a block of time to complete your assignment. Just get it done. Get it done on Monday. Get it done on Sunday night. Just get it done. Okay? However you organize, whatever works for you, whether it's a calendar, your phone, but this is a term that you really are going to have to master: your prioritization skills, your organizational skills, your time management. This is a busy term for you guys. Okay. This is the late work in there again. Everybody knows how to get their NCLEX questions, right? It's in your modules, the categories, the subcategories you pick. They're all in the weeks of your module. So I'm going to skip through these slides. Does anybody not know how to get their NCLEX questions? And let me interject here. Every single assignment that you have to do for this class, you need to initiate from your module. Okay? Or at the top, it says start assignment or submit assignment. Like, for example, for your NCLEX questions, you can't go into like www.evolve.com. It's not going to work. It's not going to let you upload it as a PDF, and we can't accept screenshots. So just make sure all of your assignments are submitted through the module, or started and submitted through the module. Okay, and I don't know if you guys should know this, but NCLEX questions, I'm a big believer in rationale. So any assignments that you can do, case studies, NCLEX practice questions that will give you rationale, to me, that's a huge benefit to learning rationale. So if you do a set of NCLEX questions, and let's say you score like a 30, go back and redo it. Okay, you can only submit it once, but you can do the exercise as many times as possible. That's if you get a 30, that probably means you have some knowledge that you need to get. And so all those 20 questions you got wrong are going to come back to you with rationales, are they not? Okay, read the rationales and retake it. Get yourself up to a 40. I mean, I'd love for everybody to submit a 50. That'd be great. But you can redo your NCLEX assignments as many times as you want, and you should be taking advantage of the rationale, and then submit it when you have the score you want to submit. So if I'm just giving you a heads up, if you submit anything less than a 40, I'm going to send you in the comment section. I'm going to say, hey, I'm going to reopen this assignment for you if you would like to try and resubmit for a higher score. But I have to manually open it for you. But you'll get an email like that from me. And whether you choose to do it again and submit a higher score, that's up to you. But at least I'm giving you the opportunity. So don't
Are the
submit it.
NCLEX questions due on Sunday night? I'm sorry to
Yeah.
interrupt.
Yeah,
Okay,
that's all in
thank you.
all the modules have due dates in there.
Thank you.
Yep, all the assignments in the module have due dates. So don't submit me anything lower than a 40, because I'm going to shoot it back to you. And not to give you extra work to do, but to take advantage of the learning that you're missing with all the missed questions. Okay, no screenshots. HESI, we're going to be sending you out, hopefully before week 2. We have a HESI review that's a compilation of the whole term. So you can follow along with it the whole term. And so by the end of the term, everything on the HESI study guide, at least the topics and the concepts, should be covered. So you'll get that early on. And then again, HESI case studies, take advantage of them. They're good case studies. You get the rationale, right? So you'll have 2 of those. Do you know how to, the case studies are already populated into your modules. Well, case studies, writing papers. I sent you some APA guidelines. You're expected to, do reference pages or cite sources on your discussion questions and your papers. Everything is in APA format. Okay. And you should be totally familiar with APA format, right? At this point. Rubrics. That's how I got to know your rubrics. Taking exams, we kind of went through that. We know their times. You can only take it once. So the whole point of exams is if you're having an issue, you need to stop the exam, right? Stop the exam, contact me, and we will problem solve. Okay, so I don't want to get bogged down with exams today. We'll talk about those more as it comes up. HESI's, you'll get your HESI study guide that you'll have. Week 10 will be full of HESI reviews. You all know the drills on HESI, right? Your remediation is due, and all those due dates will be given to you at a later time. Okay, you all saw this last term, the expected hours of remediation, right? That's not new. Let's see. Review and questions. So you prepare for the HESI. What remediation could your online instructor review with you to help you prepare? Well, we'll be doing case studies that will have lots of case studies that will have not remediation, but rationale. Let's see. And these are this last slide 51 is just questions to ponder. Okay, so that's the that's the PowerPoint. Anybody have any questions? Pretty straightforward. Anything shocking or surprising? Anything new that, like, holy crap, where'd this come from? Shouldn't be any of that.
I have a question about the NCLEX questions, or do we just click on any of the?
Nope, let me show you. All right, so, let me show you. So I'm going to go to, where am I going to? I'm going to our class. So this is our class, Wednesday. NCLEX, let's go to the module. Everybody can still see my screen? I think I have too many things open. That's the problem. Okay. I can't believe all the wonderful resources you guys have in your student section, student resources. Unbelievable. Hey, is anybody having a problem? If you're having a problem accessing the book, you got to let me know. Okay. Stay on after, send me an email. There's your, okay. So this week, I think I put my due dates in there, right? January 15th, is that Sunday? Yeah. Okay, so week 2, where's your first, no, okay, here's your first, Christina, here's your first NCLEX, okay?
I know how to get to it. I was just wondering, do we click on, because there's not like a community, option. Do we click on like MedSurg?
No,
or?
no, we give you the, let's see. Okay, here you are. So there's your, so you have to write down these subcategories, and that's what you click on when you first pull up NCLEX. So if you're looking, select your subcategory in Foundations of Care. You select communication, community health, special populations, spirituality, culture and ethnicity. So each week you have an, is that what you're asking?
Yeah, yeah, thank you.
Yeah, everything's right in there. On all four weeks that you have your NCLEXs, everything's in there. And remember, start it, do it all from here. Okay, do it all from your modules. So let me just point out a couple. Let's look at the syllabus real quick. There's that grading matrix that we talked about, same as that was in the orientation PowerPoint. Key grade assessments, what are those? We went through that. HESI, we went through that. We went through late work. We went through, you have to have a 78 before anything kicks in. So this is what I'd be looking at every week. Essentially, the modules are built from the syllabus. Okay, so for example, this week, right? Here's what we're covering: orientation, syllabus, right? And then here's all your concepts that I sent you a recording on. Community-based nursing, history of public health. These are all your different chapters. Okay, so this week you should have gotten the PowerPoints in chapter 1, 2, 3, 9, 23. Okay, so that's your second column. Third column is your assignment. Okay, your professional development plan. So that's why one of the things I need you to understand is in every week in this syllabus, it didn't get changed. It says complete and submit attestation. Ignore that or just cross through that. It's not in your module. Okay, it's not in your module anymore, but it did not get changed on the syllabus. So every week where it says, this is week 2, complete attestation, okay? There's no attestation anymore. Okay, so I want to point that out to you. Okay. So I like to just skip through the syllabus quickly as far as topics of what we're going to cover in community health, right? What is community-based nursing? History of public health, evidence-based practice. Everybody knows what evidence-based practice is, right? Well, we use that in the community as well. The best available data research to provide care. And that goes right into the community as well. Okay, healthcare systems, vulnerable populations. We cover the school nurse. I'm over here now. These are all the areas we cover. Cover the school nurse. We cover family health risks. Your discussion question due next week, I think it's next week. I know it's due next week, actually, is on common childhood ailments. So we'll cover that in week 2. Okay. And we cover what are some special populations in the community we talk about. They're significant because we provide a lot of attention to these populations. Poverty, we talked about that. Your most common vulnerable populations. People in poverty, homelessness, mental health, teen pregnancy is a big one. Cover that. And then how is government and law? How does that mix in with community nursing? We talk about home health and hospice nursing, faith community nursing. I know this is a review, but I'm just trying to give you an idea of how much is covered under community nursing. Environmental health, think about it. Think about the community you live in right now. Think about the environmental risks. Do you live near an airport? Do you live near a highway? Do you live in an industrial section? Do you live in a high crime community? What are your environmental risks? Do you live near railroads? And then I think Devin mentioned early about epidemiology. How do we track things? How do we identify? What Devin was talking about at the beginning of class is essentially epidemiology. We as community nurses are also epidemiology nurses. We're always looking, like when I was a school nurse, I was always tracking how many cases of pertussis, how many cases of chickenpox, what do I have to report to the health department? How do I keep the kids that are not immunized safe if there's a pertussis outbreak? So yes, that's what Devin was referring to. We talked about occupational health nursing. Okay, how do you do a community assessment, right? Rather than assessing your pediatric patient in your clinical or your med-surg patient in your clinical, how do you do a big overall community assessment? How do you assess the health of the community? And much of our role in the community is education. So we talk about health education in communities. How do we provide health education? What are the barriers? All the different populations. Okay. And then economic influences in the community. What happens if you have people, families, communities living in extreme poverty? How does that affect them? How does that affect their education, their healthcare, their access, their nutrition? And then certainly big in community is violence and human abuse, human trafficking, domestic violence. Then we cover infectious diseases and prevention and control in the community. Big, big, big topic in the community. Okay. Disasters. Nurses participate in disaster preparation, responses, management after. So disaster management is huge in community nursing, right? Again, back to Devin's point early on, surveillance and outbreak. That's what we're doing in the community. We're also quality. You know, everybody has a quality assurance and a quality improvement department or person that handles that in the hospital. Well, we also have those standards in the community. The community has its own scope of care, right? Ethics. Ethics is huge in the community. You know, what do you do? What do you do? Well, lots. I mean, we face ethical issues all the time in nursing. Okay, and we face ethical issues and ethical dilemmas all the time in the community nursing as well. So ethics is really important. Cultural. I mean, think of how diverse our cultures are right now. How do we become culturally competent to take care of all different kinds of clients and their families and be aware of their cultural needs and values and beliefs? Okay. And then in week 9, we start pulling it all together before HESI. So I just wanted to go through the different topics we'll be covering. Does that give you kind of a overall picture of all the things you need to think about if you're out in the community? It's huge. I mean, community nursing is tough. You bring all your tools in your toolbox, right? You're not specializing in critical care. You're not specializing in OB. You're not specializing peds. In community, you could be taking care of any kind of patient at any age with any kind of chronic illness. Think about chronic illness. That's our biggest concern in the community. Two biggest concerns are chronic illness and the elderly. People are living longer. That's where lots of our resources are going, caring for people with chronic illnesses and caring for the older population. Okay. And then the last thing I want to review is our modules. Okay, you guys all know how to look at these modules. Okay, so week 1, here's all the reading. And I usually copy, I usually send an announcement on Sunday, and essentially, can you guys hear me? I send an announcement on Sunday, and I usually just copy and paste this page for everything follows the same, your syllabus and your module has the same information. It's not extra. And your announcement has the same information. It's in 3 different places. It's all the same. Okay. The reason why we want you to look at the Healthy People 2030 website in this week, because in week 3, you're going to have 2 group assignments. Okay. So you can skip ahead to week 3 if you want and take a look at what the assignment is. Okay. This is your first group project. Okay. I'll break you out into groups over the week. By the end of the week, over the weekend, you'll know what your group is. Okay. And so here's what your group has to do. And I don't do the same. I want to interact with all the different campuses. I want you to meet different people in the class. Okay. It's not going to be your buddy. Okay. And here's what you do. Okay. I'm going to assign each group one of these case studies. There's 3 of them. Okay. Alpha group, Bravo group, Charlie group, and one's going to be assigned case study 1, 2, 3. And you're going to work as a group and come up with the answers to these case studies. All right. It's going to be the same group for your week 7 project. You stay in the same groups. Okay. So that's the first group project is in week 3. And then if you go to week 7, okay, here's your second group project. You have to go to the week they're due to get how to do it. So in week 7, I don't care if you work ahead, but in week 7, you're going to be picking from this website right here. You're going to be picking an infectious disease. Okay, and you're going to do a project, a little research paper on it. Okay, and here's all the things you, pardon me, that need to be put into your research project. Okay, so I'm just giving you a heads up. Get 2 group assignments. You'll have your groups by the end of the weekend. In your student resources or in your shell, you at least have the emails of your peers, correct? When you pull up your roster, you have emails, right? Or I don't mind if you put in the chat asking for people's number. I don't care, but somehow you have to find a way to connect. Okay, so that's first thing about your 2 group assignments. The other big project you have is due in week 9. Okay, it's called a vulnerable populations. There's your group. Vulnerable populations assignment. I would highly suggest you take a look at this in the next couple of weeks. This is something you do not want to start on week 8. Okay, it's a project that you can knock off early in the term if you would like to. Okay, I told you at the beginning of class, you're picking a vulnerable population within your zip code, and it's a PowerPoint. Okay, you select a vulnerable population, goes through what you need to put in your PowerPoint, identify the population, what are the risks, what are the resources that you have in your community for this population, what are the gaps, and summarize everything. And here's some suggestions of vulnerable populations that we all have in every one of our communities. So pick something that you have an interest in. Okay. So that I wanted to mention your vulnerable populations assignment. And then the rest of things that are due are, discussion questions, NCLEX. There's your first case study in week 3 that you do as a team. You have our exam. Week 4, you got a HESI case study, another discussion question, NCLEX. So other than your professional development plan and your vulnerable populations assignment, everything else is discussion questions, NCLEX, HESI case studies in your 2 group projects. Okay, so I think it's manageable, but you've got to put the work in, and you got to turn in these assignments, but they're not big assignments. You get them done early in the week, and you can go, bye, time to focus on my other 2 classes. Once you fall behind in this class, there's so little KGA. I mean, if you do poorly on exam 1, you don't have a chance to bring up your grade till week 6, right? So your study guide is going to be an excellent roadmap to getting prepared for the exam. Your study guide is pulled together from the concept recordings that I'm sending, from your readings, from your, has anybody had a chance to listen to the concept recording? I would like your feedback. Has anybody had a chance to listen to it? No? Okay. Well, when you listen to it, I'd like your feedback. So I went through all the chapters, tried to highlight, and you'll see the way I teach is through objectives. Okay, the objectives for each chapter is what we need to know. It says at the beginning of each chapter, by the end of this chapter, you should be able to, articulate, discuss, name, whatever. So that's all in my video, in my recording. Okay. So other than, getting your group work done, your professional development plan shouldn't take that long, for half an hour maybe, to do. Your vulnerable populations, if you get going early, you're done. And the rest is pretty simple assignments. I just don't think it's a big deal. But if you fall behind and you don't study for exam 1 and you do poorly, I guarantee you just play catch up the whole term. Okay, so just don't blow it off. Okay, don't blow off exam 1. Get off to a good start, It covers week 1 and week 2 material. You're going to have a study guide, you're going to have plenty of reviews, and you'll be fine. Like, community nursing is not hard to understand. I think what's challenging in this class is how you pull everything together. It's helping you guys understand how most of your knowledge already exists about this class. Now it's taking your knowledge and putting it into practice, caring for vulnerable populations or different populations in the community. And in the community, our patient can be, or a client in the community could be an individual. It could be a family, right? It could be a group in the community, say the elderly or the homeless, or it could be the community as a whole. And that's how I tackle that in my recording. So this was basically an introduction. So how are we all feeling? Are we feeling less stressed about this class?
Yes.
No, I'm serious. Seriously, I mean, just keep up. The unit exams are pulling in PEDS scenarios, med-surg scenarios. You already know the information. Now we just have to apply it to the community setting. All right, what
So
questions?
I have
do you
a
guys
question.
Yep, yep.
So I think I heard you mention it earlier, but I just wanted to clarify. Are you okay with us going ahead as far as weeks, or do we have to be so strict onto specific weeks? Because if, like for me, if I can get my NCLEX questions out of the way, then I would love to do that. But if that's not allowed, then I just want to make sure of that.
Well, the reason why with the bigger projects I'm okay with, but the NCLEX questions, the weeks they're due follow the content we're covering that week. Here, you have to have, and you've been told this before, you guys have to have 2 submissions a week, right? One is always attendance, and the other one is whatever assignment. So like for week 1, you only have 2 things to submit this week. Makes sense? You have your attendance, which I'll take care of, and your professional development plan. But if you go ahead and start, you can do your NCLEX assignments, just don't submit them until the week they're due. Okay, because you do have a couple of weeks where you only have a couple of things due. And so if you've gone ahead and submitted, I don't know what week it is. I think there's a week that it's just attendance and an NCLEX. If you've already submitted that NCLEX, then you only have one, what am I trying to say? You only have one.
Like one
submission,
objective left to do.
One submission. And so you're, quote, considered absent for that week because you only had one submission. So, I do have to go put some availability dates in the modules. I just need to figure, don't work ahead. I wouldn't say don't work ahead, just be cognizant of making sure you have 2 submissions every week, right? And plus, if you work ahead, you're also taking time away from med-surg and peds. You just stick with it and get your work done here, move into your other classes. There's really no need to work ahead in this class. But,
Okay, thank you. I appreciate it.
Does that help?
Yeah, definitely. I just kind of like to know because,
Yeah, of course. Yeah. But make sure you're caught up if you're working ahead. All right. What questions do we have? What are you thinking? Are we like so excited now to take this class? So excited. Rebecca's laughing. Why are you laughing? Devin's laughing. Why are you laughing? It will go quickly, guys. Okay? It's going to go quickly. And we're all going to pass together because we're all going to work as a team to get everybody over the finish line. Right? That's our goal. Move on to your last term. That's my goal. That's all I have. I have 4 minutes as the gift of time. That is my gift to you today. Because we said we'd end it 30 after because we didn't take a break. So, well, now it's 3. So you now have 3 minutes of the gift of time. Go start working on your professional development plan. Knock it off.
Thank you.
Okay. All right, that's all I have.
Thank
If you want to stay on, have questions, let me know. But again, if you have any questions after today, just reach out, shoot me an email, shoot me a text. Week one is
Thank
always
you.
busy trying to get situated.
Thank you,
Um,
ma'am. Have a good day.
Yeah. Have a good rest of the week.
Thank
We'll see you
you.
next week.
Pleasure.
You're welcome. You're welcome.
Bye, thank you.
You're welcome. Nice to meet you. Okay, let me stop my recording, number one. Who do I have?